Now, vitamin D, traditionally, it has been known as a useful vitamin for the absorption of calcium and bone health. Now, it is important to recognize the non-osseous benefits. That means besides the bone benefit, what else it offers? It offers huge amounts of benefits for metabolic health. Deficiency leads to a lot of metabolic problems like diabetes, hypertension, heart disease. It also leads to oncogenic benefits. Deficiency increases the risk of cancers. And there are many, many other benefits, including brain health. So we'll try to go as much as we can. I need to tell you that there are 92 slides. I will go up to about 40 plus, and then the rest of it is for mostly medical doctors, or if you want to have more knowledge, if time permits, I'll go through. Otherwise, I can share all the slides with anybody who wants, okay? Now, if you want to live healthier and longer, and you want to be strong at when you're old, this is a very important vitamin for you to understand and add to your supplement cart. Confusion reigns around about the dosage and whether it is beneficial. So I'll try to explain all this. Try not to miss this critical vitamin. Now, vitamin D is so critical, and its benefits and the beneficial effects resemble like hormones. So now vitamin D is known as a hormone D. So it works almost on all the cells in the body. How do we know this is there are receptors known as VDRs, vitamin D receptors, VDRs. Now, if nature has given you the ability to make a vitamin, and if it is beneficial to specific areas in the body, then you will have these receptors only in those organs. But vitamin D receptors are present in almost all the cells throughout the body, which means almost every one of your cell in the body, I don't know of any cell which doesn't require vitamin D, requires vitamin D for its survival and its health. So this is how important it is. Now, I mentioned earlier that there are about vitamins. There is a vitamin that is so critical for health, but human body does not make it, unlike animals, vitamin C. Now, as opposed to that, vitamin D is what you can make in your body yourself. But unfortunately, the lack of sun exposure prevents most of us from making. But there are many other reasons why you may not make enough of this. So is vitamin D a problem? Yes, it is a huge problem. So we should classify this as an epidemic, or better still, we call it a pandemic, because it is the largest nutritional deficiency in the world. And 90% of the world's population at risk of deficiency. And also, this is one of the most common medical problems. So it's just not about naming it as a vitamin or a hormone and talking about its deficiency, but it should be recognized that this is one of the most common medical problems in this world. And probably about 90% of the world's population are at the risk of insufficiency or deficiency. So this is a huge problem. I'll try to emphasize some of the facts why children need this and why the importance should be given during pregnancy as well. So if you look at the numbers, more than 1 billion people probably are deficient, but this depends on what is accepted as the reference range. If you accept the newer reference optimal range, then probably this number will be much bigger. So it's very important, as I mentioned, to focus in pregnancy. Best is before pregnancy and early childhood. If you want to emphasize on improving population's health. These two areas must never be forgotten. You have to create, you have to make sure healthier children are born, and you have to take care during the infancy and childhood and adolescence for them to have a solid body. Only then you can talk about prevention and reversal of diseases in a significant way. We are not talking about waiting for people to grow up and then they become deficient and sick and then you start repairing. Even that is better than not recognizing at all. But if you want optimum health, you should start before conception, during pregnancy and infancy and on. Children with adequate levels have less type 1 diabetes, which is getting more common. One of the reasons is vitamin D deficiency, that it has also been shown in some studies that giving dairy products, infant formulas, can also increase the risk of type 1 diabetes in children, insulin deficient. D deficiency in childhood can also be associated with many other diseases. One of the common ones is frequent infections. 76% of pregnant mothers and about 81% of newborns are deficient. Girls are more deficient than the boys. And in my practice, I routinely check. When I do anti-aging profile, one of the tests is vitamin D level. Most patients, I've done about maybe about 4,000 to 5,000 tests so far. I often do not see an optimum level. Most of my patients are either having insufficient levels or deficient levels. I looked at the results today of 3 patients. They were all below 50. And one of them was below 30. So insufficient or deficient. And this is a very significant problem. I'm just one practitioner who's seeing so many. And Malaysia is a tropical country with so much of sunlight. Can you imagine what will be the problem in temperate climate countries? So this is a huge problem. This is a huge problem. Rickets used to be uncommon. It's coming back. Rickets is because of D deficiency and softening of the bones. That's why there is bowing of the bone. You can see. So this is rickets, which we thought we have got over it, but then is coming back. Osteomalacia is a condition of thinning of the bones, also because of vitamin D deficiency. All these are actually preventable. You just have to have an understanding of the importance of vitamin D, what it does to your bone and other organs in the body, and how to get adequate levels. Either you expose yourselves to the sunlight and measure to see if you have adequate levels, or you supplement yourself. So the key to reversing this hormone deficiency is also this: not only taking vitamin D3, but also taking vitamin K2. I'll explain later. Remember K2. So what does vitamin D do to you? One of the most important aspect of vitamin D benefit is your immune system. It definitely is a vitamin or a hormone that has a significant effect on our immune system. And the immune system can be boosted in many ways. We all know that chronic inflammation, which is usually silent, either because you have some gut bacteria or fungus, or you have heavy metals, you have toxins, that all cause chronic inflammation. And that actually can suppress your immune system. Vitamin D helps by controlling the inflammation in the body. It is an immune balancer. What do I mean by an immune balancer is that if your immune system is weak, it boosts the immune system. If you have an overactive immune system like autoimmune diseases, it helps to balance this. So this is either it boosts up or it tones down an overactive immune system. And this is not new. Vitamin D has been studied for more than 25 years on its benefits of immune system. But unfortunately, until today, modern medicine has not accepted this. And even now, there are still doubts raised about its efficacy When we are talking about pandemic and trying to fight this pandemic with various methods that has been advocated, and we are talking about the number of people who are dying and all the panic that has been created in the entire world. Now, despite showing proof that vitamin D has its benefits, most governments or policymakers do not accept this. One typical case is UK. Their standard, I think, recommended dose is 200 or 400 IU. That's all. And it was a small study was done assessing the vitamin D levels among patients who were severely infected with COVID, and they were all found to be very deficient. So the recommendation was to increase the 400 to 1,000 units IU, sorry, and it was accepted. But about 2 to 4 weeks later, the whole decision was reversed. Why would somebody want to reverse, and why would somebody not want to try something that is so harmless for your body? So this is the sad state of affairs. And if you stay indoors, you're going to become more deficient. So it may not be beneficial. So you need to have sun exposure or you supplement. So how is vitamin D made from your body? Vitamin D is made from sunlight. And the sunlight has to convert the cholesterol in the screen. Doctors will understand this. I'll just make it simple for non-doctors. When you're exposed to sunlight, the cholesterol in the skin is converted to vitamin D. The first step happens in the liver. That's the first step in activation of this vitamin D. And then the second activation happens in the kidneys. So why this is important is if you reduce your cholesterol by taking statins or cholesterol lowering drugs, you're going to have low levels of vitamin D. This is a big problem for those who are on statins. Understand this. Number two, if you have liver and kidney problems, you may not be able to activate the vitamin D. So you will still be deficient. And another very important point is after it is activated, there is another step that needs to be done. It is the activation within your cell or intracellular activation. So 8 steps in the activation of vitamin D requires magnesium. Some doctors will find that patients who hardly have any sun exposure, when they are given a routine dose of vitamin D3, or they may not be on supplement, but they still have high levels of vitamin D. So either they are not on supplement, or when you give them a supplement, the levels go very high. But it does not make sense. It shouldn't make sense to you that a small dose of 6 to 10,000 IU can bring them to a very high level. The reason for this is the patient is likely to be magnesium deficient, which means the first step and second step in the activation can still be normal, but the final step, intracellular activation, may not happen. So there's a lot of vitamin D in the blood, but very little inside the cells. So if someone has unusual amounts of vitamin D levels in the blood, which doesn't explain your dose, your supplementation, or the amount of sun exposure they have, then consider magnesium deficiency. But anyway, the point is, if you lower your cholesterol, you become vitamin D deficient. If you have liver and kidney problems, you will be deficient because you cannot activate the vitamin D. So vitamin D, besides the immune system, it lowers fatigue and increases your energy. So it's a very good supplement or a hormone to increase your energy levels. And 72% of patients who complain of lethargy or chronic fatigue syndrome could be low in vitamin D. And when you supplement them with vitamin D, it directly increases the energy levels. But of course, there are many other reasons for chronic fatigue syndrome, or if you generally have fatigue, and one of the common reason is if you are low in thyroid hormones and if you are low in testosterone as well. Magnesium deficiency can also increase fatigue. So the relationship of cholesterol to vitamin D. If you are low in cholesterol, you are low in vitamin D. So what do you see? In neurodegenerative diseases like Parkinson's, Alzheimer's, and multiple sclerosis, both cholesterol levels and vitamin D levels are usually low. And if they are on statins, then all these neurodegenerative diseases risk increases significantly. So if a patient is on statin, and if there is coexisting vitamin D deficiency, then the patient's risk of getting neurodegenerative risk is very high. What about hair and skin? Vitamin D helps you to have beautiful hair and skin because it reduces the inflammation in the body, and it helps in the treatment of or prevention of eczema and psoriasis and hair loss. It also helps to protect the skin against the potential damage and oxidation from the sun. So if somebody is exposed to strong sunlight, or if you easily get sunburn, you should consider that you could be low in vitamin D. And vitamin D is necessary. If you want to have good skin, you need vitamin D. And so it helps to reduce the damage done by the UV rays, and also that causes the wrinkles on the skin. What about sleep? Insomnia is a huge problem even among youngsters, because of course they sleep late and there's a lot of handphones and computers used, especially at night. Vitamin D levels improve the quality and the quantity of sleep, and it is critical if you want to experience deep and more restorative levels of sleep. I have mentioned before that it is during deep sleep between 12 midnight and 3 a.m. is the time when you can repair and regenerate your body. So going to bed early, having deep sleep, enjoying deep sleep is very important. If for some reason you are not able to sleep well, then consider vitamin D to give you a better sleep. And this is important, especially for aging people. Those who have poor quality of sleep will find it difficult to enjoy optimum health. What about the brain? It definitely helps in the brain health. If you have brain fog, if you have trouble focusing, you could be vitamin D deficient. Vitamin D enhances your mind and concentration abilities. Normal levels, if you optimize vitamin D, it should help in emotional balance, better cognitive function, and better quality of sleep. Why is this important? If you look at even young children, young adults, um, that the problem is in the morning, they are so lethargic. They have brain fog. They are not able to focus well. They are not emotionally balanced. One of the reason is vitamin deficiency. But anytime if somebody has energy or concentration or mood problems in the morning, consider the other hormones as well. Thyroid hormones, cortisol, and testosterone. I just give you some tips as I go along as to what else could be the problem, cause of the problem. Now, there is a close association of vitamin D deficiency with schizophrenia and depression. This is one reason. Actually, it's not difficult to understand that depression is more common during winter months. One of the reason is D deficiency. Autistic children sadly also have low levels of vitamin D, and this is often not recognized. Vitamin D is also very important for heart health. Its deficiency is associated with increase in the risk of heart disease, and this has been shown in many studies. When I say heart health, it is not only the optimum functioning of cardiac muscles, it's the atherosclerosis. How does vitamin D deficiency contribute to atherosclerosis or the narrowing of the heart vessels that can lead to heart attack or stroke? Is because vitamin D is a very powerful anti-inflammatory hormone. We know that a lot of narrowing of the blood vessels is caused by underlying chronic inflammation. And vitamin D deficiency can be associated often with K2 deficiency. So when these two are deficient, one is vitamin D. When it is deficient, of course, you don't get calcium that is absorbed. Any amount of calcium that is absorbed will not go to strengthen your bones. And so when someone is also having associated vitamin K2 deficiency, the calcium which is supposed to go into the bones to enhance the bone strength will go and deposit outside the bone. So this is known as non-osseous calcification. So this is how you get calcium deposits in your blood vessels, in your kidneys, and then you get calcaneal spurs on your soul. And all these are signs of extra non-osseous calcification, calcium outside the bone. And this is associated with vitamin D and K2 deficiency. So vitamin D definitely has a strong connection with cardiac health. What about bones? Often calcium is given as a routine supplement to strengthen the bone. And many children and women are encouraged to drink soy products to strengthen the bone. And of course, the standard advice is to drink milk or milk products. None of this is going to strengthen your bone, and they are going to cause more health products. For example, dairy products, they are very acidic. They leach your body of minerals. They don't add to your minerals. And soy increases, although this phytoestrogen, it can increase the levels of estrogen to a significant level where it causes problems for both men and women. So if you are deficient in vitamin D, you cannot have strong bones because the absorption of calcium from the intestine depends on availability of vitamin D. Once calcium is absorbed, you need vitamin K2 to take the calcium and direct it into the bones. And in the bones, you need minerals like magnesium, silicon, phosphorus, and other minerals, as well as hormones like testosterone and growth hormone to put everything and strengthen the bones. So bone formation needs not just calcium. It needs calcium, it needs vitamin D, it needs vitamin K2, it needs magnesium and other minerals and hormones as well. So just by taking calcium is not going to strengthen your bone. And calcium supplementation, let me repeat, should not be taken as a routine unless you have a proven deficiency. But another point to remember is that if your doctor tells you that your level of calcium is low and you need to take vitamin D, my advice to you is check your vitamin D or supplement yourself with a standard dose of vitamin D that will help you to improve the calcium absorption, which is sufficient from natural foods itself. And then you repeat the test. Most often you will normalize your calcium levels. So if you are deficient in vitamin D, taking extra calcium will not be beneficial, but adding on to calcium on a regular basis is going to increase your intracellular calcium levels, and that is not good for health. So calcium as well as iron should not be taken as a routine supplement. Vitamin D also helps to maintain phosphorus in the balance in the body, calcium and phosphorus balance. They help to absorb these two minerals. Deficiency of D is definitely associated with decreased mineralization of the bone, which leads to thinning of the bones and more fractures, which is a huge problem in the elderly. What about metabolism? Vitamin D deficiency, we know, is associated with obesity. And because it decreases your metabolism. So if you optimize your vitamin D levels, it improves your metabolism, reduces the risk of obesity. And remember, those who are obese can become even more deficient in vitamin D because vitamin D will be locked up in your fat cells and won't be available in the general circulation or to be used in the intracellular activities. So it can be considered as a weight loss vitamin. Several studies, including observational and interventional studies, shows that vitamin D intake reduces COVID infection, corona infection. So the SARS-CoV-2 infection has a lot to do with your immune system, which I've already mentioned many, many times. If time permits, I'll go through the two different parts of the immune system and where vitamin D actually helps. But many studies have proven that vitamin D deficiency is associated with increased risk of not only SARS-CoV-2, but all viral infections. This is the reason why common flu is worse during winter months. Now, how difficult it is for governments to accept this common sense and put forward a policy where people can check or optimize their vitamin D levels. Because you can see in temperate countries, winter months, many, including children, adults and children suffer from common flu. And the senior citizens and those who have comorbidities are the ones who suffer most, end up with sometimes even ending up with death, because when you get pneumonia in an elderly and sick patient, I mean viral infection, common flu in an elderly and sick patients, they end up with pneumonia. Diabetic patients have the same risk. And this is what we see in COVID. The elderly and the sick are at a higher risk. And they are the ones who are more deficient in vitamin D. And when you hospitalize them, they become even more deficient. So vitamin D is deficiency is clearly associated with increased risk of viral infections. So hospitalized and nursing home patients are at a higher risk. So what was the treatment those days when we didn't have all these drugs and lots of modern treatment? It was just sunbathing for TB patients, sanatoriums. This was the treatment. Everybody is made to lie out in the sun and sunbathe. So that was the treatment because the benefits of vitamin D was recognized as early as 1950s. So why this recognition was lost? We lost our common sense to pharmaceutical industries. So in COVID, if you give prior to exposure, it reduces the risk of infection, morbidity, and mortality. But if you give it to infected patients, you need a higher dose, like 50 to 60,000 IU a day for a week or a bit longer. That reduces the risk of them getting worse. This has been proven in studies now, but it's still not a common practice. Still not a common practice, despite the evidence. Whereas we keep promoting treatments that are without evidence. So the optimal protection. What should be the level of vitamin D if you want to protect yourself against infections and cancers, metabolic diseases? Is about 40 to 60 nanograms. Depends on which unit your lab uses. Just look at this. If it is 40 to 60 nanograms, if you want to convert it to nanomoles, you just have to times by 2.5. So if your lab gives you nanomoles, the optimum level should be 100 to 150. So if you maintain at 100 and above, you enjoy a significant improvement in health. So for optimum health, this is a level. So, and if you achieve this level, then there is so much of protection, not only against SARS-CoV-2 and many other infections and other conditions that I've mentioned. So how at this level vitamin D helps to prevent infections, especially the viral infections, is it induces certain chemokines in the cells called cathelicidins and defensins. Now, cathelicidin especially, it's very important in the direct killing of the virus, as well as tuberculosis, TB bacteria. So these chemicals are produced by macrophages, which are our defense cells. So in our body, when you talk about immune system, we have the first line, second line, and then there is a medium that communicates or connects the two. So the first line is consisting of cells like your leukocytes and natural killer cells and phagocytes. These are cells that come to your help at the first sign of a pathogen invading your body. Practically what they do is they engulf them or they swallow them up, and they use various mechanisms to kill them inside your cells. That's done. But the body is so intelligent that it will make sure that your body is prepared for the next infection. So your second line of defense get activated. The second line of defense comprises of B and T cells. Most of you would have heard about T cells by now and B cells. They are the antibody making cells. So these antibodies defend those pathogens that escape the first line of defense, and they mount an antibody attack on these cells. And what happens is that once the immune system is activated, some of these immune cells become your memory cells. And when you get a natural immunity against an infection like SARS-CoV-2, we know that these T cells can remember the virus for the next 17 years, up to 17 years. So if you develop natural immunity, that immunity can last up to 17 years. So this is how beautiful natural agents are. Vitamin D also helps to reduce the survival of viral infection. And this coronavirus is notorious in the sense that it can, like, it's even smarter than the rest of the virus. Maybe because it's man-made, maybe because it's a wild, very strong virus. We don't know. But the fact is, it can actually instruct your cells to make a lot more viral copies. So the virus keeps multiplying within your cells, and then it goes to another cell to infect. So this is how it multiplies. Vitamin D helps to reduce this multiplication of virus. So it's a very important mechanism. And vitamin D also helps in reducing the cytokine storm. Cytokines are chemicals that are secreted. In small amounts, they are protective because they induce inflammation, which means something similar to what happens. You have redness and swelling and more blood flow. So this is necessary to control the germs from spreading. But in a cytokine storm, there is so much of widespread disseminated inflammation that your body suffers as a consequence of that. So this is what is known as cytokine storm, which is what actually pushes patients into the ICU and their deathbed, because they have so much of inflammation in their lungs that they have so much of fluid, and the fluid is as thick as a glue. So this is called cytokine storm, and vitamin D helps to reduce or prevent cytokine storm. So it doesn't only help you to prevent the infection, it helps you to protect you from getting worse. Cancer is a big problem. Everywhere you turn, everyone you speak to knows somebody who has got a cancer within their family or their friends. And we as doctors are hearing about this very often, and it's becoming common. Your lifetime risk of any one of us, the lifetime risk of getting cancer seems to be 1 in 3. So that means for every 3%, one of us could get cancer. And vitamin D deficiency contributes significantly to the increased risk of cancer. Of course, as I mentioned, it reduces the risk of cancer by improving your immune system. and reducing the inflammation. But remember about cancer, what we need to understand about cancer is that now when we do blood tests, we do tumor markers or cancer markers, which is necessary screening test. Sometimes you are recommended to do an MRI or a CT scan or a PET scan. So if the tumor markers are high, or if a lesion is detected, a tumor is detected from an MRI or CT scan or PET scan, that means the cancer has already spread. That's what it means. It is not the primary cancer. The primary cancer are still the cancer stem cells. These are the mother cells that float in the blood. So this is why those who want to screen for the risk of getting cancer, is good to check your cancer stem cells. The test is often called as circulating tumor cells, CTC. So this is a blood test where you check your cancer stem cells. Now, these cancer stem cells are the ones that grow and spread, circulate in the body, sorry, and then they sit somewhere and grow. And we pick it up as a tumor mass, and we think it is a primary tumor. And then by the time you detect this, it would have already metastasized. This is one reason why treating the tumors alone is not bringing in good results. Now, however, what does vitamin D do to us? It actually reduces the cancer stem cells from proliferation and invasion. That means the risk of spreading and invasion. So vitamin D offers benefits against cancer on multiple fronts. And another way it helps is by improving the macrophage activating factor, GCMAF. So there are many ways that we protect ourselves from having optimum levels of cancer. And remember, cancer cells eat sugar. So anybody who has got high blood sugar or consume sugar have got a higher risk. Very important to understand about pregnancy and its effects, vitamin D and its effects on pregnancy. When you have higher levels of vitamin D, there is a reduction in gestational diabetes, which is diabetes in pregnancy, reduced risk of cesarean section rates, premature delivery, low birth weight, better development. That means less congenital anomalies, better brain development. That means less dyslexia, less autistic children, better cognition and emotional development. That means children with less behavioral problems. So this is a huge benefit that has to be understood. One of the routine supplements that I give in pregnancy is vitamin D. Besides, of course, I use magnesium, I use vitamin C, omega-3, multivitamin, glutathione, and I check the hormones. One of the most important hormones to check and correct would be the thyroid hormones, because it has very serious effects if the mother is low in thyroid hormones. So there are multiple benefits. Now imagine a mother who is deficient in vitamin D and delivers a baby with low levels of vitamin D. So besides this, there is also an increased risk of fracture in the children. That's why you can see children fracture their bones very easily. It is not because they are not drinking tons of milk. It is because they are vitamin D deficient. I remember my mother used to put, she makes sure that we all sunbathe when we were born. This is what was told to me by my sisters, and I could observe the same for my younger sisters and brothers. From the time of birth, newborns and young children are exposed to sunlight on a daily basis. Bare body, except something to cover the eyes. Newborns I'm talking about, including newborns, for 10 to 15 minutes. This is what was done those days, cultural practice. Although they didn't understand the benefits of vitamin D, they knew that sunlight is good for health. Now we have so much of common sense, we have so much of medical knowledge, and yet this is highly misunderstood or under recognized. So ensure pregnant ladies have enough vitamin D because it can affect the next generation. So top 10 benefits of vitamin D: improves your immune system, protects you against cancer, induces autophagy. Now, autophagy is a beautiful mechanism. Autophagy means self-eating. So you don't literally eat yourself. What happens is the aged cells or the cells that are dying, or those there are waste materials in the body that have to be removed. Autophagy actually eats up all these things. So how do you induce autophagy? Autophagy is a mechanism. If you can induce, you improve your health. And this is definitely associated with longevity. So how do you induce autophagy? Very simple. When you rest the body, when you give a break, take a break from food, then autophagy is stimulated. This is why regular water fasting is very important. And those who regularly practice water fasting, you can see they are healthy and live longer. And those who do intermittent fasting, you can induce autophagy. And there are also supplements like AMPK, which is a master switch, induces autophagy. Vitamin D induces autophagy. So once you have autophagy, you remove a lot of dead and dying cells and waste materials, and definitely reduces the risk of cancer as well. So vitamin D also prevents dementia and cognitive decline, which is a significant problem in aging people, improves fatigue, promotes bone health, improves anxiety and depression. One of the big problem with depressed patients is vitamin D deficiency. Vitamin D, magnesium deficiency. It reduces arthritis and pain, improves sleep apnea, and for women, it also improves endometriosis and PCOS. So if you want to look at it from another angle, vitamin C is very important for cell formation. Now, how do you keep yourself youthful and you repair and rejuvenate? You must remove the old cells from the body through self-eating or self-scavenging called autophagy, which I just mentioned, and you must form new cells to replace them. This happens on an hourly basis, daily basis, weekly basis throughout our body. Now, if you keep repairing and replacing with new cells, then your body ages slowly. So age reversal and better age management should happen with cellular regeneration, cellular repair, and new cell formation. But of course, you shouldn't form too much of new cells. That increases the risk of cancer. But this new cell formation and the ability to repair and rejuvenate during sleep is offered by vitamin D. It also improves muscle health. Weakness in muscles and loss of muscle mass associated with aging is associated with vitamin D deficiency. And the other significant contributor to loss of uh, power, muscle power, energy, and muscle mass is testosterone and growth hormone deficiency. So we talk about muscle loss in aging as sarcopenia. And you have to remember vitamin D is a significant contributing factor. It improves, as I mentioned, your skin, hair, and eyes health. AMD, macular degeneration, adult onset macular degeneration, which gives you the loss of peripheral vision as you age. AMD is associated with D deficiency. So if you want better eye health, you have to optimize your vitamin D levels. I used to wear spectacles when I was in medical school, and my power constantly increased. Every year or two, I need to change my glasses. For the last over the 20-25 years, my eyesight has improved, and I don't wear glasses. Not reading glasses. Not I don't wear glasses now. I can still read quite small prints, There are various reasons for this. I regularly practice eye exercise as well. But remember, optimizing your vitamin D levels can improve your eye health. And this is probably the reason why so many children are wearing spectacles. It improves pancreatic health, which is very important because that's the organ that secretes insulin. Reproductive health, it improves the health of your blood vessels, so reduces the risk of atherosclerosis and hypertension. And I've mentioned about immune health. Vitamin D is very important for lung health. So if one is deficient in vitamin D, because most viruses are airborne and it's contagious through as droplets, and the first sign of entry would be your nose and then your lungs and maybe your throat. So actually, you see, the sad part of this is your lungs are supposed to offer you protection against pathogens because there are various mechanisms in the lung itself to filter. The secretions in the lung itself should contain the pathogens. Now, if you suffer a lung infection like pneumonia or severe lung failure because of infection, pneumonia, and a lot of accumulated secretion, that means your defense system has failed. So if you want your defense to be strong, remember you need immune boosters. Besides vitamin C, magnesium, and glutathione, vitamin D is a very, very critical hormone for your immune health. So that is how it actually helps in many ways. So we are looking at improved respiratory health. We are looking at improved digestive health, better athletic performance because of better muscle power. You enjoy better sleep, better weight management, better neurological health. So who is at higher risk of deficiency? Those who are not getting enough sun exposure, dark-skinned people. This is why dark-skinned people have to increase the amount of sun exposure, the duration of sun exposure. So if somebody wants to know how do I decide how much sun exposure I need, the word we use in medical terms is MED, minimum erythemal dose. That means the amount of time you need to sit outside for your skin to be a little bit redder. That means it's a mild degree of sunburn. You need to find that time. You need to establish the duration. And what is recommended is you expose yourself 3 to 4 times a week, half that duration. So if it takes 30 minutes for you to have that redness on the skin, mild redness, then you sit outside for 15 minutes and it has to be done 3 to 4 times a week. But the problem is you have to expose a significant part of your body. So the back must be exposed, maybe the arms, the legs. So and vitamin D you cannot make if you are covered with clothes. You cannot make vitamin D while driving because you can't make D through sunlight that gets into your skin through this glass. And indoor, even if it is the house, buildings that are covered with glass, but it's very bright inside, you still don't make. You have to be outside. So you can establish how much long it takes for you to make enough vitamin D by looking at the duration to cause a certain amount of redness. But there are problems. Aging people, we still don't make enough vitamin D. Pregnant women may still need more because the fetus also needs. If you are obese, you need more vitamin D. And infants could also become deficient. So one way of finding out is by doing your blood test, which I'll explain. So the symptoms, if you want to suspect who could be vitamin D deficient, you don't need to actually look at it, but remember the second slide I showed you, or the third slide, that 90% of the world's population are likely to be deficient. More than 1 billion people are deficient. So that figure is good enough to ring a bell. However, symptoms of deficiency vitamin D could be cancer, heart disease, kidney disease, diabetes, psychiatric disorders, frequent viral infections, bacterial, fungal infections, thin bones and fractures, sleep problems, and the list is very long. So the question is, does sun exposure kills? Now, this is how cosmetic industries and pharmaceutical industries want you to think. They say sun exposure causes skin cancer. Um, it is possible that prolonged exposure to sun can cause skin cancer. And this type of skin cancer is called non-melanoma skin cancer. But um, it is as it is a risk if you have a lot of toxic fat, in my opinion. Say somebody who consumes a lot of trans fats, cooking oils, and this is considered as a toxic fat. So if you have high levels of toxic fat in your skin, then when you're exposed to when you have prolonged sun exposure, they can be oxidized into even more toxic oils. So that probably causes cancer, but I can't quote any reference studies. This is just my thinking. However, non-melanoma skin cancer could kill about 1,200 people a year. But vitamin D deficiency kills many times more by increasing the risk of diabetes, cancer, hypertension, and so on. So the truth is, colon cancers, this is not the latest, 100,000 a year, breast cancers, 100,000 a year, osteoporosis, 25 million, hip fractures, 300,000 a year. So the problem with vitamin D deficiency is much more. So we shouldn't be afraid of sunlight. So the investigations that we should do, what we should check is 25 hydroxy D. There is another test that you can do is to find out the activated form of vitamin D3. And this is one is very expensive and it lasts in the blood for a very short period of time. So this is not routinely done, maybe for research purposes. Whereas the 25 hydroxy D could be done. Now, when I started testing in Malaysia, each test used to cost about 250 ringgit. Now, because I've increased the number of tests and many doctors have started doing, you get it at a reasonable price now. So, so this actually testing the vitamin D levels will give you an idea what is the level in the patient. So the reference range could be from 75 to 250 nanomoles. So if you want in nanograms, micromoles, sorry. If you want in nanograms, you have to divide it by 2.5. So when the level is 50 to 75, it can be termed as insufficient. Less than 50, it is considered as deficient. Whereas some authors will believe that less than 30 is deficient and less than 20 is considered very deficient. At 375 and above is considered toxic. And so far, I would have seen only 1 or 2 patients who have reached this level, but a very standard dose of vitamin D. Now, these are patients, as I've mentioned, very likely to be magnesium deficient because they are not able to activate. So there are different types of vitamin D. D2 is usually yeast-derived. D3 is often animal-derived, but D3 is much more effective and it lasts longer. And there is a way you can calculate according to your deficiency. If you take 100 IU of vitamin D3, it increases your vitamin D3 level by just 1 nanogram or 2.5 millimoles, or sorry, micromoles. So you can establish how much you need, but the standard dose that most people will require would be 6 to 10,000 IU. So, and there is another preparation called calcitriol. This is a pharmaceutical preparation. It is expensive but easy to get into the toxic levels. So this is not what is generally preferred. You can use sun lamps, you can use bright light therapy, but sunlight is free. You should make it available to you. You can also choose some tanning lights. You can read more about it in the Google. Now, whenever you use tanning lights or bright light therapy, remember to use 25 to 50% less time than the recommended so that you don't overexpose yourself. When you take regular antibiotics or antihistamines or diuretics or contraceptive pills, remember this kind of tanning lights or bright light therapy could increase your risk for UV radiation. So what is the recommended dose? Newborns and children, 400 to 2000 international units. Adults used to be 2 to 4,000. The current recommendation is 6 to 10,000 international units. Now, in infectious cases or in cancer patients and some acute situations like burns, you need to give a much higher dose. It could be as high as 50,000 or more per day until improvement happens. In pregnancy and lactation, certainly the mother needs more dose, but generally the current recommendation of 6 to 10,000 international units per day would be sufficient. The better way to take this would be a oral drops, which you put it under your tongue. Of course, if somebody has had a fracture or, as I mentioned, infections, you increase the dose. Please remember that vitamin D with K2 is better than taking vitamin D3 alone, because now the new evidence points to activation of vitamin D by vitamin K2. Both have very good synergistic effects. And there are different types of vitamin K. There is K1, there is K2, and among the K2, we have different types of K, which is called MK. There is MK4, MK7, MK9. MK7 is the most beneficial. You might be able to find a combination of different types of vitamin K as well. Now, can somebody get into a toxic level of vitamin D? The studies that so far, what I've known, show that if you take 50,000 IU per day for several months, it's possible. Otherwise, this is not common. However, it is always good to monitor the levels. What I do in my clinic is I do a standard first testing, and if I give them 6 to 10,000 IU per day for someone who is having low levels, I generally don't repeat until they come back to me for the next year. And I have not seen a toxic level. If it is there at that standard dose, then it could be magnesium deficiency, as I've mentioned before. Now, what are the signs of high levels or toxic levels of vitamin D? There is excessive absorption of calcium. So all the effects would be because of too much calcium in the body, like you have anorexia, nausea and vomiting, frequent urination, thirst, weakness, nervousness, kidney problems, itchiness, and a lot of calcification outside the bone. But these are the same signs that are associated with vitamin K2 deficiency as well. So the problem could be is not just the absorption of calcium, but because the calcium is not directed to the bones, and so the calcium end up elsewhere and caused by vitamin K2 deficiency. So the benefits of sunlight. So shall we take just vitamin D and forget about sunlight? No, because the sunlight probably has so many other benefits that we as humans have not understood them all. So but of course, when you make vitamin D from the sunlight, we know that it lasts 2 times longer in the body. And sunlight actually, when you're exposed to sunlight, you make more serotonin, or the happy hormone, and you make more dopamine, the hormone that balances you, reduces the risk of bad behavior, criminal activities, and beta endorphins that make you feel satisfied and gives you a sense of purpose and happiness. And it suppress also the daytime melatonin, the sleep hormone, so you don't feel very sleepy during the day. But the most important thing, one of the most important function of sunlight is to reset your circadian rhythm. uh, uh, the lost circadian rhythm is a huge problem even among the young. That's why you have so many young adults suffering from sleep problems and depression and psychiatric disorders. Basically, because we have lost the contact with sunlight. So sunlight actually gives you much more than just vitamin D. So when do you expose yourself to sunlight? What is the best time? Now, many times we lecture, we teach a lot of people, but sometimes we learn from participants. So when I was asked this question many years ago, what is the best time to expose oneself to make vitamin D? Now, I am a person who believes a lot in cultural practices, old, what has been practiced for hundreds and thousands of years, but I don't follow them blindly. It must make sense. There are lots of practices on the name of beliefs and feng shui, and I don't believe all. But many, on the other hand, many of these practices, traditional practices, make a lot of sense, and there's scientific basis. So we worship sun. We do yoga practices outside the sun. There is a particular yoga that is it's done just to salute the sun. And we have a type of plant which is planted outside the house, and women used to go out and do prayers out in the sun so they get sun exposure. There are many practices like this. And most of these, including pranayama, breathing exercise, is done outside, early morning sun. So what actually does the early morning sun do is to reset your circadian rhythm and then keeps you happy and healthy, like with all the hormones that I've mentioned. And when the sun rays touch your retina, your eyes, it certainly resets your circadian rhythm, and you prepare yourself for the melatonin at night. But the best time to make vitamin D level is a bit later, probably between 9 to 12. But unfortunately, in tropical countries, it's very hot. So many of us are running away from the sun, but animals sense it better. So I have got a video just to lighten you all up. Yamuna,
Yes, Dato.
Yamuna,
Yes, Dato.
can you
Can
play
you play
this?
the video? Yeah, Dato.
Oh, I don't know why it's okay, I'll
Uh,
stop, you play.
yeah, Dato.
You just do it right. Yeah.
1 second. Yeah, Dato. Uh,
Okay, anyway,
Sakti,
let me say. Now
Sakti
I
has.
have three of them in my house. They all have beautiful names,
There, Dato. It's there.
spiritual names. Her name is Ponni. We picked her up by the roadside when we went for hiking, and she has a beautiful coat. And so you see what she does. She sunbathes. I don't know how she senses. She will choose at least almost daily or few times a week. She just choose, and the usual time is between 1 to 2 p.m. She sits outside, she sunbathes, and then sometimes she turns herself to expose the other part of the body. And she does it all the time. She does this very, very regularly. So this is Ponni. And see, of course, what you see here is that She is so cute. In the morning when we are doing our prayers, the moment she hears the bell chime, she will come upstairs and sit with us until the prayer is over, and she will have a vibhuti. So this is her. Animals recognize the importance of vitamin D through sunlight. Yeah. So we should do the same. How do I come out of this? Okay. Uh,
Datuk, try the
Able
escape.
to play Datuk. Because Sati, you must enable me to share if I were to share. Ah,
and then I can do it again. Okay, as I mentioned, there are many other slides. If you want me to go through quickly, taking vitamin D reduces the overall mortality death rate from any other cause. They have a significant effects on how your genes function. Many of us could have abnormal genes that are silent. If you don't want them to give you problems, one of the ways to keep them silent is by having enough vitamin D levels. They definitely interfere with our how the DNA functions, and DNA has more than 2,000 binding sites. And those sites that increase the risk to autoimmune diseases like multiple sclerosis, SLE, rheumatoid arthritis, and Crohn's disease, type 1 diabetes, and cancers, they all share the same sites like vitamin D. So that's why vitamin D deficiency is associated with many of these diseases. We can skip this. This we have seen. One important point here to mention is this hormone. Renin-angiotensin is a hormone that is secreted from a hormone and enzyme that is secreted from the kidney. Actually, high levels can cause hypertension. This is a problem in the COVID infection as well, the cytokine storms. Erythropoietin is a hormone that helps you to make red blood cells. If you have kidney problems or renal problems, it could be most of the patients will end up with anemia because of low levels of erythropoietin. Testosterone deficiency also lowers erythropoietin and causes anemia in aging people. We have seen vitamin D and immune system. So there are many more slides here, PowerPoints. Those who want these PowerPoints for doctors and non-doctors, please request from Sati and she'll have them sent to you. The original lecture had more than about 150, but I've trimmed down to about 92. So we don't have to go through because I've covered most of them already. So we'll take some questions now.
Doctor, there's autoimmune disease can take vitamin D.
Absolutely. I mentioned that vitamin D balances your immune system. So if you have an underactive immune system, it will strengthen it. If you have an overactive immune system, it will tone it down.
I've got MG, doctor, Myasthenia gravis. Is it safe to take the vitamin D?
Certainly, myasthenia gravis, it's an autoimmune disease. You have a problem generating ATP in your muscle cells. Unfortunately, because magnesium is so important in the ATP generation, but unfortunately, myasthenia gravis patients may feel more weakness with magnesium. You can try, but vitamin D is very useful. And as always, remember, autoimmune disease, you have to heal your gut. No gluten, no dairy, no sugar, and maybe if you have any signs of gut dysbiosis, seek your doctor's advice to see if you have fungal infections which need to be treated.
Recently, I have done plasma therapy. It's helped me a lot for Mesnevia gravis.
Plasma therapy. Okay, good for you. But keep in mind magnesium as well.
Magnesium as vitamin D, eh?
No, sorry, vitamin D.
Okay,
Magnesium, I'm not sure. Magnesium can cause muscles to be more relaxed, so you may have more problems. But it's certainly worth a try because
okay,
you
okay.
need it to generate more ATP.
Okay, thanks, doctor.
Okay, bye.
Dato,
Yeah.
there are other questions from Grace. Dato, my vitamin D level is quite high right now, over 100 ng/ml. But when I checked, my osteocalcin is low. How come is this, Dato?
Sorry,
I thought that
repeat the question, Yamuna. Your
vitamin D
voice is
level
not so clear.
sorry, Dato, vitamin D level is quite high, above 100 nanogram per milliliter. But when I check my osteocalcin, it is low.
When you check you're breaking. When you check your
Osteocalcin.
why not check the red blood cell magnesium as well? There could be a connection. I'm not very sure, but there could be a connection. If you are not taking high dose of vitamin D, it's unlikely that you will have more than 100 and you still have low levels of osteocalcin. So probably you have to check your red blood cell magnesium to assess whether you're low in that as well. Maybe there are more reasons. I'm not aware. I'm not sure.
He regularly takes vitamin D3 10,000 IU with K2, Dato.
You're not very clear, Yamuna.
1 second, Dato. Is it clear now, Dato?
Okay, tell me.
She regularly takes 10,000 IU with K2 every day.
Yeah, but then the problem is if you take 10,000 IU and then if something is not settling, it's because you are not able to activate the vitamin D intracellularly. And one of the main reasons for that is magnesium deficiency.
Dato, from Swarna, if someone already has higher cholesterol and clogged arteries, how to use vitamin D? Will it reverse? Additionally, is vitamin D and K2 helps with joint cartilage?
Vitamin D, if whether the cholesterol is high, of course, you can make your vitamin D from cholesterol if you go out and expose your skin to the sun, to the sunlight. But if you are not able to, then you're not going to make cholesterol, vitamin D from cholesterol. And cholesterol levels can be high for many other reasons. So you still have to take a standard dose, which is safe for most or all of us if you are not exposed to sunlight, which is 6 to 10,000 IU. You want to be specific, you have to check your level and correct it accordingly and repeat the level to see that you are taking sufficient, you are not overdosing yourself. And of course, if you have vitamin D and K2, it's good for the strength of your bone and cartilages and tendons. The other one that you need to look at is vitamin C and glutathione for joint health.
Okay. Dato, from Mr. Yo, for cancer patient, what's the daily dosage of vitamin D?
We advise an initial dose of 50,000 IU. It's better always to collect the blood and put them on about 50,000 IU daily for a week or longer, depending on the level, of course. And about 6 to 8 weeks later, repeat the blood test. And if you have attained such sufficient levels, then you start tapering down. But the 50,000 IU should be given at least for a week or two. In my practice, what I do is this. If someone is very low, if they are deficient, I give 20,000 IU for 3 months. And then I'll reduce to 6,000 IU. Some of them, I put them up to 10,000. But this is because I monitor and I know actually when to give a lower dose. But initially, you need to know if they are insufficient or deficient. Those who are deficient, you can give a higher dose for 2 to 3 months. But for cancer patients, for patients who have fractures, those who have an acute infection, you should start with 50,000 IU for a week or two.
Okay. Dato, from Miss Saraswati, if we expose to sunlight, do we need to take vitamin D3 drop? I think Dato will address
Depends.
this just now.
Yeah, it's exposing to sunlight is very important. One is for making vitamin D, and the other is all the other benefits that I explained just now. But number one, you must expose your skin. For Asian, so the bikini exposure may not be, agreeable, but at least you can sit with shorts and t-shirts. As much as possible, expose the back portion. So if you do this as much as possible, your thighs and the legs, then if you sit outside for about 15 minutes for fair skinned people, about 20, 25, 30 minutes for dark skinned people, assuming that you are not an aged person, assuming that you are not taking any cholesterol lowering drugs, you should be able to make, but the best way to find out if you are making enough is by testing your blood levels.
Dato, from Jason, Dato, what organic food to supplement vitamin D3?
D from food could be usually vitamin. If you want food, maybe fish, but you may not get the optimum levels.
Dato, from Dr. Rabia, what should be ideal dose of vitamin D3 in post-COVID phase? My own lungs has become very weak and almost very hard to take cause of air hunger and becomes hypothermic too at times cause of cough. Just breathing exercise too. Looking forward for something more.
Uh, Now, the reason why you get COVID infection. Okay, let's assume two scenarios. If you have a strong immune system and you are exposed to a virus, then the virus just doesn't live in your body. You get exposure, the virus gets killed, your body produces antibodies and it remembers, maybe up to another 17 years. If you have weak immune system, you have a viral exposure, the viral gets into your body, the virus multiplies and it gives you problem because your immune system is not able to control the virus from multiplication. And this happens because you have been always eating a high carb diet and sugar, which suppresses the immune system, or maybe because of sleeping late, exposing yourself to the blue lights from gadgets, phones and computers at night, and you are deficient in immune boosters, vitamin D, vitamin C, glutathione, magnesium, and there are others like zinc. You must be deficient in one or more or all of them. And you could also be very deficient in thyroid hormone, which makes you feel tired and you feel cold and you expose yourself more often to infections. So if you have suffered COVID and you are not able to recover, my best advice to you is take vitamin C and find out the diarrhea dose. I've explained this many times. Take high dose of vitamin C, at least 4 grams or more as the first dose, and then keep taking minimum 2 grams or more every 2 hours. Reduce the dose if you get diarrhea and continue this until full recovery. Take vitamin D3 50,000 IU per day for 1 to 2 weeks at least. Add magnesium 500 milligrams twice a day. Add zinc 50 milligrams twice a day. And take glutathiones as a supplement. If you do all this, and if you do yoga, breathing exercise, you will feel better. And the way to actually bring out the secretion from your lungs is to do steam inhalation and do chest physio. Now, there is another way of breathing better. If you lie on your tummy, then it should help you with the collection of the secretions, so not sleeping on the back. The other one is you can put your legs on the floor, lean forward, put your arms on the floor, and put your forehead on the hands, and try to cough, breathe and cough, breathe and cough. So when you have this posture, you can also drain your lungs better. But it's a slow, deep, controlled breathing that will stimulate the cough and bring out the mucus. So if you do all this, then your recovery will be much better. And if you have access to a doctor who can give you vitamin C drips, then the recovery will be much, much, much faster. I'm sorry to hear that you have this post-COVID problem and it's lingering. Now it lingers only if you are deficient in immune boosters and hormones.
Okay. Datuk, from Dr. Sofian, since vitamin D regulates more than 900 of our genome, then it must have a vital role in maintaining our genome stability. WRT, that can you briefly explain the mechanism of action and its relation to longevity?
As we age, there are lots of aberrations in our genes. For one, we can be born with uh, genetic polymorphisms. In medical terms, we call them SNPs. That means we all have them. We don't have 100% perfect genes. We all have SNPs. So those days, it used to be thought that genes contribute to a significant portion of our health problems. Now we know that it is not actually the genes. Actually, they respond for
Datuk? Ah,
okay. If you keep the SNPs under control uh, through the environment in which the cell lives, with healthier diet, and make sure you are optimum with your vitamins and minerals and hormones, then these so-called bad genes will be under control. Nevertheless, as we age, we still have a lot of aberrations as we age. And I mentioned that there are many, many sites on our DNA. They share the common sites with vitamin D sites. So when there is a deficiency in vitamin D, we know that these are the same sites that are shared with diseases that are seen as multiple sclerosis or Parkinson's or Alzheimer's or autoimmune diseases. So, and this is probably one reason that I'm aware of that increases your risk of all these problems as we age. So when you control gene aberrations, when you control SNPs, when you control your metabolism and reduce the risk of obesity, when you improve your immune system, when you improve your respiratory health, you improve your cardiac health, you improve your neurological health, and you improve your autophagy. All these are beautiful mechanisms by which you can improve your longevity and enjoy better health.
okay, Datuk. Also from Dr. Sofian, since vitamin D is fat soluble, there is a thought that vitamin D toxicity has a much greater probability to be experienced by somebody who has a lot of visceral fat compared to somebody who has a much more lean body mass. What's your take on this?
We know that vitamin D is fat soluble, and then anything, even if it is the best of what you need, you shouldn't overdo it. But at 6 to 10,000 IU, if you have been monitoring your patients, you will hardly ever see a toxic level. That's number one. And if the standard dose of vitamin D that you prescribe increases the levels to more than what is desirable, look at magnesium deficiency as the reason, correct, and check again. And obesity, of course, I think it is the other way around, Sophia. In obesity, actually, they are more deficient because fat actually accumulates and sequestrates the vitamin D. Then it becomes less available in the systemic circulation. So the more obese a person is, whether it's mostly a visceral fat anyway, the more deficient they are. So obese patients actually require higher levels. But of course, if you want to monitor toxicity, then you need to monitor the levels. But in my opinion, it's not so common. It should be less common than in lead people.
Dato', next question from Mr. Alejandran. What is the best time for sun exposure? It was said that there are different times of exposure to sun for different benefits. Is this true?
Yes, I mentioned just now, Mr. Alejandra, that morning sun has its many beneficial effects, especially in terms of resetting your circadian rhythm, and it also increases the secretion of happy hormones and hormones that keep us sane and more balanced, and hormones that also gives you the better mood. And of course, there could be many other benefits that we have not understood yet. So this is morning sun. That's why it's always sun worship is as the sun comes up, you worship the sun, you do a lot of exercises, activities outside. This has been the cultural, this has been the tradition, centuries old. But to make vitamin D, scientifically, we know that you need to go out in the sun a bit later from 9 a.m., 9:30 a.m. onwards. But after 12, it becomes too hot. You could end up with more oxidation of the skin. So these two times, they have different purposes. But I suppose the morning sun and the evening sun may offer the same benefits to my knowledge. Anything else, I'm not aware.
Okay. Dato', next question from Dr. Pianto. Dato', are you using high dose vitamin C injection and vitamin D for treating cancer patient?
Yes, vitamin D, as I mentioned, you should start them at least 50,000 IU until you normalize the blood levels. Vitamin C, you have to give them a high dose. I mentioned this with the previous webinar. A very simple fact, but it's very sad that is not spoken about often or not accepted by policy makers, not accepted by WHO, not accepted by FDA, NIH, and not your government, not my government. The fact that animals don't get COVID, animals don't get cancers and dengue, SARS, and Zika, that's because they make their own vitamin C. Of course, guinea pigs don't make. That's why they use guinea pigs for experiments, because they don't make vitamin C. They know, and they do these experiments on guinea pigs because they are defenseless, so you can do whatever you want. You can create cancer in them, you can induce infections in them, anything. They don't defend themselves. That's why guinea pigs are chosen, because they don't make vitamin C. You and I are lucky because we are not subjected to those cruel activities. We are lucky. And fruit bats also don't make vitamin C. Other than this, all other animals make, so they don't suffer from what we are suffering. Isn't this something that has to be spoken about, something that should be accepted for better human health, instead of suffering from all these lockdowns and from the pandemic? So this is the sad side. So we actually need high dose. When you have a standard dose, I mentioned about 6 to 10 grams a day for adults. But when you are sick, you need a much, much, much higher dose depending on the seriousness of the illness you have. So in acute infections, you'll need much higher dose. For example, a goat makes 10 grams a day or 10 to 13 grams a day under normal circumstances. But when you stress the goat with an infection or any other kind of stress, the vitamin C production increases to about 100 grams. And this is how the goat defends itself. We can't increase. So we suffer. So the way to find out how much your body needs is by going with the bowel tolerance, which means you keep increasing the dose until you get bloating and diarrhea. Then you reduce it slightly and maintain the high dose and the frequent dosing. So this is how one should treat cancer patients. But of course, you have to do a lot more adjustments in the treatment of cancer patients.
Dato, from Miss Celine, Dato, do you have any single product that we can take which has got vitamin D3, K2, magnesium, silicon, phosphorus to help strengthen the bone besides growth hormones and testo?
Well, you can find a good bone formula that will have D3, K2, magnesium, phosphorus, and silicon. There is one from Life Extension, is called Bone Restore. It has calcium, but because it's balanced with the rest of it, when you absorb the calcium, I'm sure the calcium goes into your bone. That is a formula, but then I give it to someone who needs it because they are calcium deficient. Otherwise, I'll avoid the calcium and give the rest. Especially, I don't go into phosphorus and silicon routinely because they will be available in a multivitamin. What is not sufficient in the multivitamin would be the C, D, and magnesium. So this has to be taken as an additional supplement. This is what I do in my practice.
Dato, from Miss Nalini, how do we know it is our body is less of vitamin D?
Well, so lack of focus and concentration in vitamin D. Vitamin D deficiency deprives you of focus and attention because I mentioned this before. If you are having any one of the symptoms, okay, if you have any skin in if you have allergies, you have frequent cough and flu and infections, then it's very likely you're vitamin D deficient. Now, this besides if you have diabetes, if one suffers from cancer, heart disease, fractures, all these are signs, typical signs. Okay, but if you stay indoor during the day and you're outside, your nightlife being, how do you make your vitamin D? As long as we humans become indoors being during the day, it is highly possible that we are vitamin D deficient because it's not uh, easy to get from food supply. It has to be from the sunlight.
Okay.
And if you are dark skinned people, person, you are more likely to be deficient than the fair skinned person. Okay.
Okay. Datuk, from Mr. Casey Liao, should vitamin D be taken all in one dose or in divided doses?
I actually, my standard advice and what I do for myself is I just take one dose at night. But again, the question is, rational question will be vitamin D, sunlight. You expose you are supposed to get vitamin D from sunlight, which is during the daytime. So should vitamin D be taken in the morning for better benefits, and why take it at night? Well, I don't have a particular reason why I started taking at night, and I've given it to all my patients all these years at night. And none of them came and told me that they have disturbed sleep or anything, any other problems. But on the contrary, most of the patients have better sleep even if they take it at night because it's water fat soluble, it is stored in the body. It's not what you give today is done with today and tomorrow there's nothing, it just carries on. So that could be the reason. So but then a single dose is sufficient, you don't have to break it up.
Okay. Datuk, from Mr. Fred, Datuk, since calciferol has a short half-life of around 6 hours, actually, if you give only 0.25 mcg per day, then it's far from toxicity.
Maybe so, but then yeah, why go for something that is expensive and then the dose has to be so tightly controlled, and the natural form that is what the body uses would be the 25 hydroxy D, the D3. So that's why I prefer the D3 instead of calcitriol. Because it's just the activated form. Let your body do the activation. When you take the activated form, you may not be able to control.
Dato, from Dr. Rabia again, can we treat thyroid antibodies?
Excuse me, Yamuna, I just want to make a point. I think
Yeah, Dato.
calcitriol is supplied by pharmaceutical industries. Now, my question is this: when vitamin D3 is a much safer form of giving to people, even on a mass scale without much of monitoring. Monitoring is of course better, but you use a standard dose. If you are not able to monitor or test the one, it's still okay, because most of us, if we don't get sunlight, are likely to be deficient. This is a much safer form, but vitamin D3 cannot be patented. So pharmaceutical industries will not be interested in anything natural that cannot be patented, because there's no money to be made. They have to alter it, or they have to go for something that can be patented, which they claim it's their own right for the next 15 years. So I am always for something that is natural. Sorry, Yamuna.
That's okay, Dato. Sorry. From Dr. Rabia, can we treat thyroid antibodies, especially antimicrosomal antibody for thyroid with vitamin D?
Vitamin D helps in autoimmune diseases, both in the prevention and in the treatment. But the bigger problem for autoimmune disease is gluten intake and your gut dysbiosis. So you should stay away from gluten completely. When you repeat the autoantibodies of the thyroid 3 to 6 months later, you will be surprised what happens to them. They will come down.
Okay. Dato, last question for today from Dr. Rose. Is it safe to initiate injectable vitamin D3 to patients with chronic kidney diseases stage 4, 5 with deficient vitamin D? If so, how frequent to do monitoring of renal function, vitamin D, parathyroid hormone, and ionized calcium?
I don't use injection, but of course, if you are using a higher dose, because as I mentioned, those with renal problems, liver problems, renal problems, they won't be able to activate. So magnesium is very, very safe even for kidney patients, which is needed for the final activation. D3, I generally use the drops, which is there are different doses. What I use is each drop is 2000 IU. I don't use injectable, but if you use injectable vitamin D3, if someone is very low, you want to increase the levels, you still have to monitor. Now, end-stage renal failure patients are the ones specifically you need to monitor, because whatever said and done, fat-soluble vitamins need to be monitored. And for kidney patients, it will be even more important, although we know that they are very likely to be deficient. So I use the drops, I don't use the injection. Whichever way we look at it, we need to monitor.
Dato, there's another question from Dr. Pianto. When do we need to consume activated protein kinase to boost our autophagy process?
When do we use protein kinase?
When do we need to consume activated protein kinase to boost our autophagy process?
I don't have experience with activated protein kinase. What I know and what I practice is this. Intermittent fasting is a very good way, with regular water fasting, maybe once a week, water fasting. That's for 24 hours. Exercise, AMPK, which is taken as a supplement. This is natural to the body. It's a master switch to regulate metabolism and to activate autophagy. And the diabetic drug called metformin, which is safe as a drug. It is safe among all the devils. This is a good devil, so you can still take, besides helping you to control blood sugar and helping you to control the liver neoglucogenesis, which is making glucose in the liver during sleep. That's why a lot of aging people have high levels of fasting blood sugar despite controlling their diet. This because the liver makes glucose during sleep. So metformin controls that, and metformin also improves the autophagy. So this is how you can improve autophagy. If there is anything else like what you suggest, if it is safe to do so, you can give it a try. But I don't have experience in this.
Okay, Dato. I think that's about it, Dato. No more questions from the floor.
Okay. Thank you very much. Namaskaram.